Hello friends, myself Dr. Sonali Singh. I am BHMS doctor. Today I am discuss about peritonium which is very useful for first year medical student. Let's start. Peritonium. Peritonium is the largest and most complicated serous sac which is situated within the abdominal and pelvic wall. It covers mainly abdominal viscera and pelvic organs. Peritoneum is divided into two main types, parietal peritoneum and visceral peritoneum. Transverse section of abdomen showing the arrangement of the peritoneum, body wall, parietal peritoneum, peritoneal cavity, visceral peritoneum, mesentery and aorta. Number first, parietal peritoneum. It is the outer layer which covers the inner aspect of abdominal and pelvic wall. It is attached to extraperitoneal cavity. It is attached to extraperitoneal connecting tissue loosely. It receives blood and nerve supply from the wall of abdomen and pelvic. Therefore, the parietal peritoneum is supplied by somatic nerves and it is pain sensitive. Nervous system divided into two parts: somatic, joint, ligament, tendon and muscle, autonomic, sympathetic and parasympathetic. Visceral peritoneum, it is the covering of visceral organs of the abdominal and pelvic cavity. It will receive the blood supply and nerve supply from the organs covered by it, and it is supplied by autonomic nerves, so it is not sensitive to pain. Folds of peritoneum. Peritoneum can be divided into different groups. Omentum, it is the fold of peritoneum connecting stomach and in any other known as omentum, divided into two parts, lesser and greater omentum. Second one is mesentery and mesocolon. It is the fold of peritoneum which covers small intestine and large intestine. Number third one is mesoappendix. It is also a fold of peritoneum which covers the appendix. Fourth one is peritoneal ligament. All other folds of peritoneum attach together or meet with other peritoneal covering so that junctional place peritoneal covering known as peritoneal ligament. Three parts of the primitive gut with their arteries and mesentery. This is the diagram. The next one is character of the peritoneum. All abdominal organs and extraperitoneal like outside the peritoneal cavity, because all the organs are covered by peritoneal sac. In male, the peritoneal cavity is closed cavity, but in female, the peritoneal cavity is open cavity because the end of uterine tube is op- open into the peritoneal cavity, so that the peritoneal cavity through uterine tube, fallopian tube, uterus communicate with outside. Function of peritoneum: it provides lubricating surface for free movement of the abdominal organ. Number second, protection of abdominal organ against infection by phagocytes and lymphocytes. The third one is it also plays an important role in healing of wounds by altering the cell from fibroblast. Composition of peritoneal fluid. What is the composition of peritoneal fluid? The composition of peritoneal fluid is water, electrolyte, and some amount of protein and urea. Varieties of cell like macrophages, lymphocyte, etc. Applied clinical anatomy. Inflammation of peritoneum known as peritonitis. Abnormal collection of free fluid in peritoneal cavity is known as ascites. Removal of fluid from the peritoneal cavity known as paracentesis. Paracentesis in the medial plane, because this side is more or less vascular. Thanks for watching.